Hi, my name is Shrouk Messahel. I'm a consultant in Paediatric Emergency Medicine at Alder Children's Hospital in Liverpool, and I'd like to talk about what we're doing in terms of research capacity in our emergency department. So, emergency departments aren't really the traditional place where you think that research will be conducted. It's a really challenging environment. There's targets that we have to meet. There's unscheduled care. We don't particularly know when or where the ideal patient to recruit to a trial is going to come. It's a 24-hour service. You know, we've got to make sure that we're ready all the time, every day of the week, forever, to recruit patients to studies. And there's the issue of how do we recruit patients when it's an emergency, you know, and in a child. So there's ethical obligations that we have to consider, and research without prior consent is something that comes into play when you're researching emergency situations. So lots of technical challenges and lots of kind of structural, physical and service delivery challenges to deliver research in the emergency department. But at Alder Children's Hospital in Liverpool, our emergency department is really, really busy. It's one of the busiest in the country. And we saw this as an opportunity to say, well, we need to get things better for our children. We need to make sure that medicine is progressing, and is progressing for the most vulnerable in society at the need that they have it the most. And so there were some really important studies that were coming through, and in order to be able to deliver on those studies, we actually had to change the way we deliver research capacity in our department. And a few years ago, we had the opportunity to kind of think outside the box and think about how we do this using our permanent staff. Now, the permanent staff for emergency departments are not medics. They are, apart from the consultants here, they're our nursing teams and our HCAs and our allied healthcare professionals. And we put a call out to our nursing staff and our healthcare professionals and said, do you want to do a hybrid role? And our HCAs, so our healthcare associates, they're the ones who volunteered to be upskilled in research and took on this role, which was essentially that the fundamental principles of the role is that they are supernumerary to their number, so the department could backfill their post. The costs for that role actually came from our charity, the Alder charity. They bought into the idea of this and increasing research capability. And in this hybrid role that they do, it's delivering clinical work at the same time as delivering research. So not two people to deliver a job that one person adequately trained could do. And our first study that we did was called STOP RSV, and that was looking at the rates of RSV infection in children presenting to emergency departments, and that fed into the conversation that started to get the RSV vaccine kind of produced and out and rolled. And with this model of care and delivery, the HCA, we called them ARPs, so assistant research practitioners. And we trained them in consent and research processes and got them onto the delegation logs and things like that. And for a patient who met the inclusion criteria, they would be the ones to manage the entirety of that patient's care. So they would do the swab, do the OBS, start a trial of fluid perhaps, weigh the child, and then they would have a consent conversation with the parent, and then they would do the research aspects of it as well. And that saved another person from the emergency department, or it saved another person from R&D coming to do the role that is needed. And what we found with that model was that we recruited nearly 500 more patients than the other children's hospital. So it's a model that really, really works. And what is really good about that model is that the ED staff themselves really bought into it, because they were supernumerary, they were additional to the numbers, and they didn't have to provide, we didn't have to provide somebody external to the department to come and research our patients. So there was support, there was clinical support, there was research support, and in busy times they could flex between roles, which was really, really important to our senior nurses who were a little bit hesitant about about that to start with. And then, of course, when our R&D saw our numbers, they were very encouraging of that model. And now we're in a position as Alder Emergency Department. We have 5 members of the ED research team. 3 of them are ARPs. 2 of them are band 6 nurses. They need that seniority kind of like to help them out. We have research capacity 7 days a week from 7 o'clock in the morning till 10 o'clock at night. We are top recruiters for most of the studies that we participate in across a national platform. We contribute to about 20-25% of total numbers of studies that we open. So we've found a way to unlock research kind of delivery in our department from a group of staff who we didn't really look at to begin with. We didn't really kind of think about them as people who would deliver research, and it's given them a career. And it's given them some career prospects. They're happier in their role. They're learning new things. In fact, I think last year they did their own little piece of work and they presented it at a conference. You know, wouldn't have heard of that a few years ago. So, what I imagined this would be for other departments around the country is that this is a really cost-effective way to deliver research in emergency departments, blur the lines between research and clinical work, deliver it in one protocol, and you'll see that you'll be able to recruit the patients that you would have previously missed.